I recently had a call from a gentleman, okay, and he was talking to me. He saw our video on masturbation, that from prawn masturbation, and he gave me a call. He was saying, and he was telling me about his story. He's a 45-year-old man. So he went to so many doctors. The reason why I'm saying this particular story is I want to tell you how much people, especially doctors, misdiagnose this issue of prawn masturbation. Okay, so this person is hearing about this prawn masturbation for the first time through our video. The moment he saw it, he called me immediately, and he said that he has been masturbating in the prawn position for more than from the time he started masturbating, he has been doing it only in that position. And for more than 20-25 years, he has been doing like that. So he had this exact same problem of having an erection for successful partner sex. So he went to doctor after doctor to find a cure. They couldn't find any reason why this man have a problem. They did all kinds of tests. They couldn't find any solution. And eventually, you know what? He went to a urologist who asked him to do an implant,
Oh,
penile implant,
yes.
and he did. He did a surgery, and now after so many years, now he is seeing the video and saying that what an idiot am I doing this.
Yeah.
So
That's very sad. Penile implants are, they are, uh, they're, for some people, it certainly can be appropriate. But for the vast majority of people, we ought to be exhausting alternatives. Yeah.
but doctor,
But I'm
yeah.
sorry to hear that story.
But doctor, I know that is why I'm so concerned. This prawn masturbation, particularly this particular problematic technique, your penis will have absolutely no response to any kind of sensation. And this can easily mislead a doctor into diagnosing it wrongly, right?
Yes, yes. And unfortunately, there are financial incentives for penile implants, which could be unfortunate, as opposed to something where you'd be referring out of your practice. There's often a talk about the fact that for when all you have is a hammer, everything looks like a nail.
Absolutely. But just to understand from you, doctor, when does someone really require a penile implant? What are the situations which warrants for that surgery?
Well, one, if there is a vascular problem, and the surgeon would feel that there is no way to revascularize the penis due to a disease process, cancer, for example. Okay, so that would be certainly one situation. Another time, some people are born with significant abnormalities. So, for example, a very, very small penis.
Okay, micro penis.
One that yes, a micro penis, exactly. So that would be another case where a penile implant might be helpful to allow for intercourse, penetrative sex. So those pop up into my mind. But most significantly, of course, is a disease that perhaps some significant trauma could be another instance where an implant would be appropriate.
So until and unless there is a serious damage or injury to your penis, you don't need an implant at any cost.
That is my opinion. I'm surely sure that there are some surgeons who would take issue with that. But those three instances that I gave you would be examples that I can think of, and I don't believe there are many more that we'd want to exhaust other ways in which to treat erectile problems.
Yeah, and the cancer which you mentioned was penile cancer, right? And
yes,
penile cancer is an extremely rare cancer.
It is. Nonetheless, it does exist, and those are the kinds of cases.
Also, vascular issues is also relatively rare, if I I'm not mistaken.
I think it's in the eyes of the beholder. I think there are I'm not familiar enough with the incidence of the necessity of revascularization.
Okay. And what about the likely damage of the veins, venous leakage and all that? Is that possible through masturbation? Can masturbation really induce serious, like the masturbation which we are talking about, prawn masturbation, can really create such situations?
Not to my experience. No, my clinical experience does not reveal that would be a problem. It more has to do with desensitization. And as one surgeon I once spoke to said that it was actually his belief that there could be micro injuries.
Okay.
But that doesn't mean that micro injuries can't be healed, that you can't be nurturing the increased sensitivity of the penis to have an erectile response, a satisfactory erectile response.
Yeah. So in the normal circumstances, there is no way in which there can be damage to the veins of the penis or things like that, or a venous leakage.
In my experience, no, that wouldn't be a likely event. I mean, there are all kinds of ways in which the veins and arteries that feed the penis can be damaged. We talked about injury and trauma, but in terms of what one thinks of when we think about prone masturbation, that's not the likely event at all.
Yeah. So unless and until there is a direct impact or injury to the penis, that is extremely unlikely through masturbation.
Correct. I mean, as I said, there can be severe injury, but severe injury is very unlikely to occur as a consequence of masturbation. Severe
injuries are unlikely to occur due to masturbation alone. That is what you're saying.
That is my statement, yes.
Correct. Yeah, got it. So the reason why I wanted to clarify this is because a lot of young men have apprehension that they think that when they do exercises in the gym, abdominal crunches, and they suddenly get a pain in the abdomen area, and the next day, if they when they do masturbation, they are not getting an erection, they think that they have injured their penis in some way or the other, and that is why the pain is happening. So there is a lot of misconception about how.
Indeed. Yeah, I agree with you, Sangeet. We're talking about two circumstances that may be somewhat coincident in time, but to imply causality would be an error.
Absolutely.